Hey everyone, Dr. T here for FocusKIDS, and today we're doing a FocusKIDS quick tip, gastroesophageal reflux or spitting up in infants. And it's coming up right after the intro. So your baby is born, you're all excited, you get her home and she's spitting up all over the place. This is one of the most common questions and concerns I get from parents. My baby's puking all the time, and usually parents are worried that something is seriously wrong with their brand new bundle of joy. So in today's quick tip, we talk reflux, baby style. What's normal? Why it's normal for babies to spit up? What's not normal? And if it's not normal, what are we going to do about it? Normal infant reflux or physiologic reflux is called gastroesophageal reflux or GER, while abnormal reflux or pathologic reflux is called gastroesophageal reflux disease or GERD. Almost all babies have some reflux, but not all babies spit up. This is basically because babies have immature nervous systems that, among other things, can lead to reflux and spitting. In general, if your baby is gaining weight well and meeting her developmental milestones, her reflux is probably normal. However, to be sure, we're going to ask some more questions and do a good thorough physical exam to make sure it's not something more worrisome than just normal reflux. So what are some things to look for that may be concerning? First and foremost, poor weight gain or weight loss is obviously worrisome in any infant, and not just for GERD, but a host of other things as well. Pain after feeding, possibly indicating acid reflux. If your baby is having significant choking or breathing problems after feeding, that would be worrisome. If she's turning blue after feeding, that would be worrisome as well. Also, if she's having projectile vomiting, and by projectile, I mean exorcist-like shooting across the room vomiting. Projectile vomiting is particularly worrisome, especially if your baby is about 3 to 5 weeks old. This is particularly worrisome for something called pyloric stenosis. This is potentially life-threatening and requires immediate evaluation. Pyloric stenosis requires surgery to correct. The good news is that it's pretty uncommon, but if your baby does have it, once the surgery is done, the pyloric stenosis is done. No more treatment is needed. It's a one-time surgery and it's done. All of these things would be concerning that it's not normal infant reflux. So what if your baby's reflux isn't normal and it's GERD? Your pediatrician may recommend reflux precautions such as keeping your baby upright for 20 to 30 minutes after feeding, preferably by holding her, and this will help keep your baby calm, and keeping your baby calm will also help with her reflux. Your pediatrician may also recommend thickening her feeds, as this sometimes can be of some benefit if she's not gaining weight very well, because thickening the feeds will add some extra calories. If none of these conservative methods work, your pediatrician may recommend a trial of an H2 blocker such as Pepcid, or in more serious cases a PPI, a proton pump inhibitor, such as omeprazole. If none of this works, your pediatrician may want to get some imaging studies such as an upper GI or a swallow study. There are other studies that can be obtained as well. Your pediatrician may just go ahead and refer your baby to GI for evaluation as well. Unless your baby is suspected of having a milk protein allergy, changing formulas is not helpful and is generally discouraged. The take-home message and good news of all of this is, in the vast majority of babies, parents can be reassured that your baby's reflux is a normal process that they will typically outgrow by 12 to 18 months of age without any intervention at all. Reassurance is the rule of thumb for most babies with reflux. If your baby is having any of those worrisome signs or symptoms that I talked about, talk to your pediatrician or your primary health care provider. If your baby is having projectile vomiting, this is potentially an emergency situation. Contact your pediatrician or primary care provider immediately, or take your baby to the ER. And as always, if you have any questions or concerns at all about your baby, ask your pediatrician or primary care provider. That's what we do. That's what we're here for. For FocusKIDS, this is Dr. T, and this has been a FocusKIDS quick tip on infant reflux. Thanks so much for watching, and if you enjoyed this video, don't forget to like, subscribe, share, and comment below. Until the next one, we'll catch you on the flip side. We are out. Oh, and if you're interested in a more detailed look at the anatomy and physiology of reflux, we've posted a separate, more detailed video. Thanks.